Cancer and diabetes. Cancer and diabetes are among the most damaging and most prevalent diseases in the world. Connections between the two diseases have been obvious for decades, but only recently a reason for the relationship was identified. It was noticed that high glucose levels in blood may contribute to the onset of cancer. Conversely, some cancer fighting treatments or drugs may cause hike in blood sugar readings or suppress natural insulin production and may lead to diabetes. Many patients have both diseases, leading to potential treatment complications for both. Uncontrolled blood sugar levels may lead to poor cancer treatment outcomes. High blood sugar may also cause cancer related tiredness and fatigue in patients. Usage of steroids often during cancer treatment may make it difficult to control blood glucose levels. Now we must look into see how diabetes and cancer are interlinked. Is there a genetic background to this? Yes, there is now clear evidence in link between diabetes and cancer. Possible mechanisms for direct link between diabetes and cancer include hyperglycemia, hyperinsulinemia, and inflammation. Cancer, as we all know, usually develops when mutations to a cell's DNA cause the cells to grow out of control. Various studies show that high blood sugar levels or hyperglycemia alter the structure of DNA and also suppresses its normal repair functions, which may make the genome unstable, creating an opportunity for cancer cells to grow. It was noted much earlier that cancer cells use glucose as fuel, consuming and metabolizing the sugar at a far higher rate than normal cells. Several epidemiological studies have shown that there are metabolic links between certain cancers and diabetes, particularly type 2 diabetes mellitus, which involves insulin resistance and pancreatic beta cell dysfunction. Therefore, it was noticed that individuals with diabetes have higher risk of bladder, colon, pancreas, ovary, breast, and endometrial cancers. Although the mechanisms linking these cancers and diabetes are still speculative, some of the risk factors for the two disorders may include hyperglycemia, which could result in formation of advanced glycated end products and oxidative stress, hyperinsulinemia, which normally occurs as a result of insulin resistance or insulin from exogenous sources, inflammatory process, and obesity. Hyperglycemia causes oxidative stress by inhibition of the antioxidant function of thyroidoxin by thyroidoxin interactive protein TXNIP. TXNIP inhibits thyroidoxin, which is an reductase with antioxidant activity. This TXNIP is found to be strongly induced by glucose and is responsible for impaired angiogenesis found in diabetes. Hyperglycemia also causes high rates of protein glycation and thereby formation of advanced glycation end products that leads to long-term diabetic complications. Formation and accumulation of these advanced glycated end products during prolonged high blood sugars were found to be involved in carcinogenesis. Advanced glycated end products directly damage the protein structures and extracellular matrix modification and indirectly binds the receptor for advanced glycation end products. Thus, in cancer and diabetes, AGE's formation results, which in turn increase AGE rage dependent stress response, leading to increased oxidative stress and chronic inflammation, thus creating a favorable environment for both cancer and diabetes progression. High blood sugars also modulates the immune system functioning, and therefore the immune response against cancerous cells lessens during hyperglycemic situations. The anabolic and anti-apoptic actions of insulin promote tumor development in hyperinsulinemic subjects through binding of insulin to insulin receptor, the insulin-like growth factor, or a hybrid receptor. Several biological mechanisms link obesity and overweight with cancer. An increment in circulating sex steroids, due to overweight is a well known factor for carcinogenesis. Insulin resistance is a feature that is very usually linked with obese people, and it results in high level of circulating insulin, a well established risk factor for cancer. Diabetes impacts a huge risk for liver and pancreatic cancers, as both organs are exposed to high concentration of endogenously produced insulin. Hyperinsulinemia and hyperglycemia have role in stimulating the growth of cancerous cells and cause higher risk for malignant transformation. Hyperglycemia or high blood glucose levels may induce DNA damage and inhibit DNA repair. It is this impact on DNA that increases a diabetic's cancer risk. What are the commonest types of cancers detected in diabetic patients? Diabetes mellitus is reported to be associated with an increased risk of different types of cancer, including pancreatic, liver, breast, colorectal, urinary tract, stomach, and female reproductive cancers. In this brief talk on the link between diabetes and cancer, I do not wish to go into the details of treatment of various cancers, etc. My emphasis today is to bring an awareness among diabetic patients about the chances of developing various cancers among them if diabetes is not kept under good control. Also, to bring awareness among them how a lifestyle management and dietary control can prevent the occurrence of various cancers in diabetic patients. Learning to keep blood sugars under control and avoiding hyperglycemia reduces the risk of damaging the DNA. One of the most effective steps to control diabetes and reduce the risk of cancer is to eat a healthy and balanced diet. A diet which is rich in vegetables, fruits, and whole grains, along with regular exercise, keeps one's blood sugar and weight under control. Obesity should be controlled properly. Reducing alcohol and tobacco plays a big role in reducing risk of cancer and diabetes. Diabetic patients should be aware of their increased risk for cancer and hence should regularly undergo proper screening. Reduce fat intake in your diet. Limit the consumption of salt in your diet. Take vitamin D supplements. Develop a regular exercise schedule. There is still uncertainty over the fact whether the association between diabetes and cancer is direct. That is, if it is directly due to hyperglycemia or high blood sugars, or whether diabetes is a marker of underlying biological factors that alter cancer risk, such as insulin resistance and hyperinsulinemia, or whether the association between both is indirect due to common risk factors like obesity. Various research to establish the link between diabetes and cancers is ongoing. Lot is learned in this subject. There's a lot more to know. It's a long road to travel before we have concrete information on the link between these two diseases and how to prevent them.